My name's Travis Loop with the Water Environment Federation. I'm here with two guests to share some exciting news from WEF. I'm joined by Dr. Andrew Sanderson. He is Chief Medical Officer for the Water Environment Federation. Dr. Sanderson, thanks for coming on.
Thank you for having me.
And I'm joined by Amy Kirby. She is National Wastewater Surveillance System Program Lead for the U.S. Centers for Disease Control and Prevention. Amy, thank you for joining as well.
Good to be here.
Dr. Sanderson, could you kind of share the news with everybody, what announcement we're talking about here?
Sure, Travis. So we're very happy and proud to announce that the CDC has selected the Water Environment Federation to develop and manage a nationwide network of water utilities, public health agencies, and scientific laboratories to provide training on wastewater-based surveillance. This is a cooperative agreement, and it marks a continued relationship between WEF and federal agencies to provide partnered education and training.
Amy, could you talk a little bit more about the CDC's interest in wastewater-based disease surveillance?
Sure. So wastewater surveillance is a really powerful public health tool, not just for COVID, but for many diseases. And there are really four big advantages for wastewater surveillance for this type of disease surveillance. First, it's efficient. A single sample at the wastewater treatment plant can represent hundreds, thousands, or even millions of people. Second, it captures both symptomatic and asymptomatic cases, unlike our clinical surveillance, which is skewed towards symptomatic and severe cases. Third, it isn't tied to medical care. So it doesn't matter if people go to the doctor or if they have access to testing in their community. We can still detect those cases through wastewater surveillance. And finally, it's fast. So we can have data in hand 5 to 7 days after that toilet is flushed, which means that wastewater data is often the first indication that cases are going up in a community.
Terrific. So like you said, this isn't just about coronavirus. This is an important tool in public health going forward. Dr. Sanderson, what's WEF's perspective on the usefulness of wastewater-based disease surveillance?
Yeah, so the concept of wastewater-based surveillance was proposed about 20 years ago in 2001. And since then, it's been used to identify exposure to toxic agents like pesticides, microorganisms like viruses and bacteria, and also illicit drugs. And WEF has always sought to protect its workers through analyzing the wastewater they come in contact with and developing both safety protocols and procedures. Now, using similar sample collection techniques, wastewater-based surveillance can be used to rapidly respond to emerging threats in the community and give public health officials another tool to combat diseases.
Now, this is certainly an extension of WEF's over 90 years of working in public health. Very exciting. Amy, you're the program lead for the National Wastewater Surveillance System. Could you talk more about that program, what that is?
Sure. So the National Wastewater Surveillance System, which we call NEWS, is a CDC coordinated but state-led program to generate community-level disease information by testing wastewater. So we work with health departments to establish wastewater testing networks in their communities. This data is then submitted into the CDC NEWS data system, which provides standardized analysis, ensuring that the results can be compared across communities and even across states, even if they're using different laboratory tests. The results are then reported back to our health department partners so that they can use that as part of their response decision-making. And I also will note that although this system was established as part of the COVID-19 response, we built this to be a long-term surveillance system that can provide information on multiple diseases in the community.
And could you talk a little bit about why the Water Environment Federation was chosen for this particular work?
Yeah, so utilities are a really critical part of NEWS and any wastewater surveillance effort. And we needed to be sure that they would get the support that they needed to engage with health departments and to understand how their operational design decisions may impact this type of disease surveillance. And WEF was really uniquely positioned to be able to help us connect with those wastewater utilities. WEF's 35,000 members in all 50 states ensured that any utility participating in the news system will know that WEF is a trusted resource to them. WEF also has a deep experience and capabilities in creating and delivering training, which will be necessary to help us grow news quickly. Finally, we really look forward to partnering with WEF on conferences like WEF Tech and the upcoming Water and Public Health Conference to really bring together the public health and water sectors.
We deeply appreciate that perspective on WEF's value in this work. Dr. Sanderson, could you talk a little bit more about the WEF side and why WEF believes it's well positioned for this particular work with CDC?
Sure. So as you mentioned, Travis, WEF has been around since 1928. So for nearly a century, we've endeavored to protect both the environment and public health. And this type of institutional knowledge is powered mainly by our members because they have extensive presence in the fields of sanitation, engineering, public health, and laboratory science. WEF has developed a robust network of water quality professionals and communicates efficiently through conferences, campaigns, and many technical publications to give these workers the information they need to perform their critically important functions. WEF is a place where innovation travels quickly and sharing best practices in the industry is fostered. I think this makes WEF a logical partner for both health departments at the local level and for the CDC on a national level. And I also wanted to add, I love, Amy, that you call it news. That's a great acronym.
That is very catchy. Last question I have, Dr. Sanderson, could you detail a little bit the activities that WEF is actually going to be conducting as part of this work for CDC?
Yes. So WEF is going to collaborate with the CDC to develop, disseminate, and adopt specific guidances, develop clinical guidelines, and use best practices for prevention and control of infectious diseases, with a particular focus on strengthening critical infrastructure around the country. This is going to include developing and managing a network of wastewater utilities, as I mentioned before, public health agencies, and accredited laboratories that are currently participating in wastewater-based surveillance efforts. The network will concentrate on information sharing and providing standard operating procedures to facilitate problem solving. WEF will also provide training and technical assistance and support about wastewater surveillance for frontline wastewater and public health personnel so that we can enhance our understanding of the spread of diseases in communities. Finally, WEF will implement projects that pilot new approaches and new technology in wastewater-based disease surveillance.
Well, thank you very much. Dr. Sanderson and Amy, thank you for this information. I know that there will be much more to come as all of this work takes place and continues, and WEF will be sharing that information along the way. But thank you both very much.
Thank you. Looking forward to continued partnership.
Yes, thank you.